Assalamu alaikum wa rahmatullahi wa barakatuh. License exam MCQ for laboratory scientists and technologists. Question number 1. In order for hemoglobin to combine reversibly with oxygen, the iron must be complexed with haptoglobulin, freely circulating in cytoplasm, attached to transferrin in the ferrous state. So, in order hemoglobin to combine reversibly with oxygen, it should be in the ferrous state. So, the correct answer is D. Question number 2. In which of the following disease states are teardrops cells and abnormal platelets most characteristically seen? Hemolytic anemia, multiple myeloma, glucose 6-phosphate dehydrogenase deficiency, myeloid metaplasia. The correct answer is myeloid metaplasia. So it is D. Next question. In the normal adult, the spleen acts as a site for storage of red blood cells, production of red blood cells, synthesis of erythropoietin, removal of imperfect and aging cells. So the correct answer is erythropoietin acts to shorten the replication time of the granulocytes, stimulate RNA synthesis of erythrocyte cells, increase colony stimulating factor producing by P lymphocytes, decrease the release of bone of marrow reticulocytes. So the correct answer is P. Stimulate RNA synthesis of erythrocyte cells. Question number 5. Which of the following is the most closely associated with idiopathic hemochromatosis? Iron overload in tissue, target cells, basophilic stippling, ringed sideroblasts. The correct answer is iron overload in tissue. Question number 6. Factors commonly involved in producing anemia in patients with chronic renal disease include marrow hyperplasia, inadequate erythrobiosis, vitamin B12 deficiency, increased erythropoietin production. The correct answer is P. Inadequate erythrobiosis. Question number 7. Which of the following is the most closely associated with iron deficiency anemia? Iron overload in tissue, target cells, basophilic stippling, chronic blood loss. The correct answer is D. Chronic blood loss. Question number 8. An enzyme deficiency associated with a moderate to severe hemolytic anemia after the patient is exposed to a certain drug and characterized by a red cell inclusions formed by denaturated hemoglobin is lactate dehydrogenase deficiency, G6PD deficiency, pyruvate kinase deficiency, hexokinase deficiency. The correct answer is B. Glucose 6-phosphate dehydrogenase deficiency. Next question. Which of the following are found in association with megaloblastic anemia? Neutropenia and thrombocytopenia, decreased LD activity, increased erythrocyte folate level, decreased plasma bilirubin level. The correct answer is number 1. Next question. Thalassemia are characterized by structural abnormalities in hemoglobin molecule, absence of iron in hemoglobin, decreased rate of heme synthesis, decreased rate of globulin synthesis. The correct answer is 4. Decreased rate of globulin synthesis. Next question. Which of the following types of polycythemia is a severely burned patient most likely to have? Polycythemia vera, polycythemia secondary to hypoxia, relative polycythemia associated with dehydration, polycythemia associated with renal disease. The correct answer is 3. Relative polycythemia associated with dehydration. Next question. A 14-year-old boy is seen in the ER complaining of a sore throat, swollen glands, and fatigue. The CBC result are white blood cells is 16,000, hemoglobin is 12.8, platelets is 180, RBCs is 4.37, hematocrit is 38.4%. And the differential is absolute neutrophilia 3.9, absolute lymphocyte is 6, absolute monocyte 0.5, and absolute atypical lymphocyte is 3.2. So, what is the most likely diagnosis? Acute lymphocytic leukemia, chronic lymphocytic leukemia, viral hepatitis, or infectious mononucleosis? The correct answer is 4. Infectious mononucleosis. Next question. Which of the following technical factors will cause a decreased erythrocyte sedimentation rate? Gross hemolysis, small fibrin clots in the sample, increased room temperature, tilting of the tube? The correct answer is 2. Small fibrin clot in the sample. Next question. Which of the RBCs indices is a measure of the amount of hemoglobin in individual red blood cells? MCHC, MCV, hematocrit, MCH. The correct answer is 4. MCH. Next question. The RDW-CV and RDW-SD performed by automated cell counters are calculations that provide an index of distribution of RBC's volume, calculated mean REC hemoglobin concentration, calculated mean cell hemoglobin, the mean REC volume. The correct answer is 1. Is an index of the distribution of RBC's volume. Next question. The erythrocyte sedimentation rate can be falsely elevated by tilting the tube, refrigerated blood, air bubbles in the column, specimen being too old. The correct answer is 1. Tilting the tube. Next question. The laboratory tests performed on a patient indicate macrocytosis, anemia, leukopenia, and thrombocytopenia. Which of the following disorder is the patient most likely to have? Iron deficiency, hereditary spherocytosis, vitamin B12 deficiency, acute hemorrhage. The correct answer is vitamin B12 deficiency. Next question. The most appropriate screening test for detecting hemoglobin F is osmotic fragility, dicyanate solubility, Kleihauer test, heat instability test. The correct answer is 3. Klehauer test. Good luck. Like and share and subscribe to see you in part 4.